Hello, we reached the fifth part of this series, and it's gonna be dealing with the vestibulary positioned appliances. In between them, we find two very good representatives: Frankel functional regulator and oral screens or oral shields. Oral shields are actually based on a philosophy which is similar to a Frankel appliance, but it's a very simple appliance. We use it as a preparation for some, let's say, more complex appliances like Frankel or any other bimaxillary appliance, which is putting this very high pressure on the lip seal. So during the oral shield wearing and also doing some exercises, we really reinforce lips. We can also activate a different part of the orbicular oris muscles, and also we are promoting the nasal breathing. So the change in balance of the forces between the tongue and perioral musculature causes expansion of the jaws as well. This can be used in deciduous or also mixed dentition. The next level is a complex Frankel appliance, with which actually functional appliance era starts. This appliance activates all muscles in the oral cavity: the buccinators, the protractors, the tongue, and what is more important is that it trains them very passively. So the functional appliance actually are defined as loose-fitting or passive appliance, which harness or eliminate natural forces of the orofacial musculature that are transmitted to the teeth and alveolar bone through the medium of the appliance. Also, by excluding the pressure force of the buccinator or the pushing force of the tongue or controlling the force of the tongue when it's over the teeth, we kind of produce a very nice environment for the growth to express. Frankel appliance comes in two different ways: the Frankel 2 and Frankel 3. Both have some buccal sheets and also vestibular pellets, which are actually pulling the lip away from the basal bone or basal alveolar bone so that the development can come to its best. On this case, I would like to show you how actually even in a little bit older ages than it's normally indicated, we can make a very nice result within less than a half year. So the idea of this forced bite and pseudoprogenic status is to reduce the causative factor and the bite, which is now predetermined to the patient's left, to actually bring the patient back to the center, to centralize the occlusion so that we can continue with the fixed appliance and organize everything nicely. On this slide you will see how the actually appliance lies in the mouth and how I overcorrected the height with the bite planes on the laterals, and also how I forced the mandible to almost central position. So these pictures are with the appliance, and also these pictures are 6 months later without appliance. So to go back, with the appliance and without appliance, we see that the adaptation of the orofacial musculature and structures is completely done. So this Frankel is indicated during mixed dentition and early permanent dentition up to 12 years of age. To affect changes in all three dimensions, we need to take a correct construction bite. What we experience are two treatment effects. Frankel appliance serves as a template against which the craniofacial muscles function, and its influence on skeletal and dental development by passive, mostly, activation or exclusion of the forces which are unnatural. Indicated in skeletal and functional class 2 or 3, in horizontal or neutral growth vector cases, bimaxillary protrusion and open bite cases. The contraindications are class 1 with a severe crowding, thumb sucking habits, severe dental velar problem in permanent dentition, and of course uncooperative patient because the appliance is rather bulky. Again, I would like to stress the instructions to the patients are of utmost importance. So, appliance should be worn this and this time. Remove appliance by catching it for this or this part. Clean it by using a toothbrush and toothpaste after the wearing. Rinse the appliance all the time in the clean water. Don't be afraid. Initially, patient can feel discomfort, plastic taste, excessive salivation, mild pain, difficulty in swallowing, difficulty in speech. That all can be overcome within 48 to 72 hours. The difficulty in speech should be avoided by training the tongue and the structures by reading aloud at home, not avoiding talking. Avoid playing with the appliance while using it or also using the tongue. If any breakage or any problem occurs, please call the orthodontist. So the instructions are really important, and we really need to make a good connection with the client so that the compliance comes to the utmost and we can see the result as I've shown you with this Frankel 3 appliance. So this is it for the removable orthodontic appliances, vestibulary positioned ones. The next thing, I will just go through a myofunctional therapy within a few words because it's gonna be covered with a complete seminar. So myofunctional therapy, especially myobraces, the different types of trainer and other type of appliances, should be always combined together with the exercises, because the idea of a myofunctional therapy is exactly that: the exercises together with the passive appliance which trains or exclude the bad forces out of the mouth so that the structures can express in the full potential. I will focus on myobraces because I have some experience with it.